Ni aje watu wangu, Rick's Kids hapa. Watu wamekuwa kiuliza, unajua kila time watu tuna discuss places nyingi ambazo nurses wanaweza work. Watu wengine wanasema nursing homes, home health. Of course, you have a variety of places we can work. But people always say working in a nursing home is not easy. For me, having worked there, so I'll share a little bit of what I know from nursing homes. For the nursing homes, you can go to work there anytime you want. First of all, it's easier to access jobs from the nursing home compared to the acute care settings like the hospitals. Nursing homes, it's easier. But the main thing is, when you go to a nursing home as a registered nurse, it depends on the kind of a nursing home you are working at. We have the nursing homes where the nurse, the registered nurse in this case, does all the work. Like they check blood sugars, they give medications, like they do everything, like everything that's needed for the patient. But then we also have nursing homes where we have medics. Medics, they give the medications to the patient. And then we have the LVNs or the LPNs. They do other things for the patient, and then the nurse, you can be there, like maybe someone to consult whenever something is needed. Like a patient needs an IV line, you can go and fix it. A patient needs wound care, you can go as a registered nurse and do it. For example, the nursing home might be having a wound care nurse, but at the moment, maybe it's at night shift, that patient needs like wound care before their nurses come to see them in the morning. So you can always do that. So the main thing about nursing homes, it's like you have a lot on you. Like you are responsible for every patient on the floor if you are a registered nurse most of the time, especially at night. Another thing is you give the medication to those patients, you do the admissions, you do the discharges, like it's a lot. And another thing, just in case anything goes bad or something messes up, even if you're at home, you'll just receive some calls from the facility, the state is following up on this. So sometimes it's a good job, but it doesn't give the satisfaction like when you go home, I did my part, now I can rest. Because sometimes you are doing your offs, but someone calls you concerning something that happened like a week ago when you are working. So you have to cooperate with them to make sure like you get a better solution or to know what happened. So nursing homes are not bad. But if you are going to work in a nursing home, know your roles and responsibilities before you go in there. If you feel that's too much for you, because as long as you have accepted the assignment and you are working there, something happens, you are responsible. And no one wants to know beyond that. You are responsible and you are responsible. So nursing homes are not bad, but just make sure you are safe where you are working. Thank you.